Hi, I'm Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. What should you expect on your first visit to a fertility centers? Here's what you should be ready with, and these are the questions you should be asking the fertility center. The first thing that you should look at is your own personal information. How long have you been married for? How long have you been trying to get pregnant without contraception? Have you had intercourse for 1 year without any protection, and has it been regular? What is your frequency of intercourse, so that we get to know that you're having intercourse during the time of ovulation as well. Then, do you have problems during sexual intercourse? Do you have a problem? Is there any infection? Is there any burning, itching on both sides, even the male and the female? Your husband also should keep a track of all that. Are you able to ejaculate properly? And this goes for the husband. Is the semen being ejaculated properly? Is it being deposited inside, or is it not sufficient? These are a few observations that you need to make. If you are able to track all this, and if you are able to report this, a lot of critical information is passed on to the doctor, and it's very easy for them to then diagnose the problem and give you the solution for it. Then when it comes to the wife again, we will talk about how to track your periods. When you are planning to go to the doctor, recollect the last 3 month period date. That is your first day of period. Just recollect that and try to see what was the duration of your period cycle. Was it 28 days? Was it 32 days between the first day of 2 cycles is what you need to track. Once you track that, you have a fair idea how regular or irregular your period is. From that also, your doctor can take a lot of inference and decide how it is, what is causing the problem. Is it hormonal imbalance? Is it problems associated with hormonal imbalance? Or is it because of age and so on and so forth? So these are important things that you should look at. Next, when it comes to your periods again, you should look at how your periods are. Are they very heavy? Are they too scanty? How's the color? Is it looking chocolatey, or is it brown? Is it red? These are things that you should look at, because the doctor is then trying to see what they can analyze from that. If it is red, it's okay. If it is chocolatey and brown, it could be endometriosis associated with period pain as well. All those things have to be recorded with the doctor. Now, again about the periods, are they very painful? Are they excruciatingly painful? Is the pain also radiating to your back, your stomach? Specifically, is it because of endometriosis, is what your doctor is trying to infer. So all these details have to be shared with your doctor. When it comes to the male, definitely you have to look at your ability to have sexual activity. Are you able to ejaculate properly? Is your semen sample coming out and not going behind into the urinary tract? Is your urine milky after ejaculation? That gives a fair idea that maybe the semen's ejaculation is going back into the urinary tract, and you could be suffering from retrograde ejaculation. These are a few things that you need to be aware of. These are questions that are going to be asked. So please be prepared with these questions. If you have previous reports, you need to take them. If you had previous treatment cycles, or if you had trackings, if you had ovulation inductions, if you had ultrasonography, tube tests, any sort of tests and the reports associated have to be brought to your doctor's notice. Only then they will be able to pinpoint on the problems that have been brought to their notice. The previous procedures are taken into account, and then future treatments can be decided. If you want to understand more about this, please feel free to contact us. Ask our call center staff to give you more information, and please come to Ziva Fertility. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.